Red bulb and warning outside imaging room. A signboard mentioning, "Do not enter if the red light is on," should be placed prominently. The bulb should be switched on while the imaging is in progress and switched off thereafter or during idle time. The patient's bed should have a side railing for the patient's safety. For vulnerable patients, the usage of side railing is compulsory. Casualty or emergency room. The casualty room should preferably have dedicated nursing and medical staff, basic investigation facilities, a wall clock, MLC related forms and formats, necessary consent forms, a panic button to call for additional help in case of emergencies, adequate lighting and visibility, preferably CCTV. Staff should be oriented to counseling and emergency handling procedures. Autoclave tray and drum. The tray or drum should have a label mentioning the date of autoclaving, date of expiry and contents. Cleaning of portable suction machine. All the staff members using the reusable suction machine should ensure that it is always kept clean and decontaminated at all times. Suction machines must be thoroughly cleaned and decontaminated in accordance with the manufacturer's instructions after each use. Suction catheters and tubing should be attached only at the time of use. The machine should have a sticker as shown. All suction machines should be serviced periodically to ensure it is working correctly, and details of this service should be documented. Ambu Bag. There should be an adequate number of Ambu Bags in the hospital. The number of Ambu Bags should far exceed the number of ventilators. If the hospital is treating pediatric patients, then they should keep pediatrics Ambu Bags too.